Okay, my name is Kayla Gorlett, and I did my literature review on nursing ratios. So to begin with, here's my introduction. It just states what I'm doing and who I interviewed, and then we will go into the literature. So the first article that I did was between Medicaid expansion and nurse staffing ratios and hospital readmissions. So this article just discussed the way that Medicaid influences that, the care cost, and the Medicaid revenues that they gain from it. And then in the second article, it was the nurse staffing ratios and patient outcomes in a low-income country. So this article did the study on the effects of nursing staff ratios on nurse-sensitive outcomes that have not yet been achieved worldwide. It was at a university hospital in a low-income country, and the results included were higher rates of nurses per patient were effective in improving some, but not all, of the outcomes. The results of this study were inconclusive of the benefits in the low-income country, which they need to do more research on it. So the last article I did was the comparison of nursing aides to registered nurses, which is a mixed staffing ratio. We see that a lot in the United States, but this research article was done in China. So they did a study on groups with 100% nursing care and 0% nursing assistance, 90% RN care with 10% nursing assistance, and then 75% RN care with 25% nursing assistance. This study found that the 75-25 mixed staffing ratio was the best one that reduced the medication errors, nursing costs. It did increase urinary tract infections, but it did decrease ventilation weaning. So it's still a mixed results, but I think those are better results than the 100% nurses. So this is my body, and this is just I talked about who I interviewed. Her name is Katie Pearson. She works on my floor at Methodist. She is a charge nurse, and she does this schedule. So she talked about how being assertive during staffing so that we can get correct staff to take care of our patients. Our patients are really busy. It takes a couple extra bodies to get some patients to and from the bathroom, into the showers. We usually staff for 3 nurses and 2 aides at night, but since this pandemic, we've been kind of picking up, which is calling for 3 nurses and 3 aides. So Katie also talked about how hard it has been to find the correct staff just within the whole hospital. So this is just the conclusion on how important the nurse-to-patient staffing ratios are and how it increases productivity between staff and the healing of the patients. Studies show the increase of errors and patient safety hazards when there's a lack of nursing staff, and I have seen that firsthand on my rehab floor. Thank you for watching.